You wait 8 weeks, you give PPSV23, Pneumovax, and then you can give another Pneumovax 5 years later. That's real simple. Let's say they already got the Pneumovax before Prevnar 13 became available. That's on the bottom. You do still give next PCV 13 before you give your next PPSV 23. You need to wait a year, though, between the Pneumovax and the Prevnar 13, and then another 8 weeks before you give PPSV 23. But PPSV 23, again, a 5-year interval. There's no other guidelines for what happens after that, whether or not you're going to need any more after that. So again, the rule should be first PCV 13, second, 8 weeks later, PPSV 23, and then 5 years later you can repeat the same. So if you want to get a perspective on zoster and how to treat it, I have that's an editorial I wrote in A&R. I love this quote. It comes from a speaker at the ACR who actually said, if you don't fear the infection, you won't value the solution. And such is the case when it comes to zoster vaccination. 1/3 of us, all of us, are going to have a zoster infection, and the rate rises as we get older. So again, by the time most of us have gotten older, we've probably been exposed to the varicella virus, so we probably have some immunity, and most of this is not, when you do get vaccinated, it's not a neo-immunization, it's basically a booster immunization. So we want to treat it because the consequences are horrible. These are the numbers on the bottom. The normal population risk, all of you, I assume, are normal, we'll look later, 4 per 1,000 patient years is the risk of getting zoster in a year's time. OA is about 10. RA is about 14. RA on a TNF inhibitor is, 14 to 17, right? It's not that much different, maybe a little higher. Lupus is higher, GPA is much higher. TOFA and BARI, JAK inhibitors, are as high as the highest we see in our immunosuppressed patients. That would be